I'm here joined by Professor Anil Sooklal. Welcome. It's so good to have you here. Let's start with how would you like to describe the energy of this event?
Well, firstly, I think this is a timeless event, having a focus on healthcare and especially integrating traditional medicine into the mainstream towards AI and beyond. I think it's a timeless summit. Health is perhaps the most important issue in any society.
Right.
I've always maintained the greatest asset and wealth of any society is its people, but you need healthy people. So healthcare is at the center of ensuring that you have healthy societies, prosperous societies. But I think it's also important the focus of the summit of integrating traditional medicine into the mainstream. Traditional medicine has been there for centuries in various cultures, be it India, be it China, be it Latin America, the Middle East. They've all first and foremost depended on traditional sources of medicine for the health and well-being of the people. So within the BRICS, and I have served as South Africa Sherpa for 13 years, so I know the journey of traditional medicine within the BRICS family. Of course, we realized much early in the BRICS evolution that health is important, so we introduced the health ministers meeting and a specialized working group on health. But we also recognized that we all have very rich traditional medicine backgrounds, and that we should also pay focus on that and not just allopathic medicine. So as early as 2017, there was a joint declaration on traditional medicine from the BRICS Ministers of Health. And during India's chairship of BRICS in 2021, India put forward the idea of an MOU on traditional medicine and a specialized working group on traditional medicine. Now that is established, it is there, and I think within BRICS we see health as an integrated process, a holistic approach to health, both traditional medicine, allopathic medicine, and it's about the well-being of the human being, both in terms of physical health, mental health, and spiritual health. And I think this is what comes out very clearly in the traditional medicine working group. And I think it's also important that the focus is also on research, because as I said, we all come from rich cultures of traditional medicine. How can we share knowledge? How can we reinforce each other? And how can we work together through R&D in terms of addressing the major health challenges side by side with allopathic medicine? We need this integrated approach. They are not opposed to each other, and I think the approach of BRICS is they complement each other. And I think this is what the summit is about.
So of course people were getting cured before we found allopathy, but with the modernization coming into the picture, everyone was running towards the science, towards the facts, and somewhere in this whole change we forgot, somehow we can say a little, we forgot about our roots, about the traditional medicine which has been working so far for us. But now that we are going back to it, would you call it a transition, or you are saying that we are ready to accept both?
I think, unfortunately, one of the negatives of colonialism, and all of our countries suffered from colonialism. Colonialism negated the rich culture and civilizations that we came from, including our healthcare systems, that worked since ancient times. And in many of our countries, South Africa, India, Brazil included, they instill the mentality that it is only Western medicine that is superior and can provide a cure for the various ills that society undergoes from time to time. But yet, since ancient time, the well-being of the individual depended first and foremost on indigenous knowledge systems, indigenous medical systems, and it has been there. So what is happening now, and you are seeing this as a cycle, where in nearly all countries that have very rich traditional medicine histories and background, African traditional medicine, for example, is also so rich, as is Indian, as is Chinese, as is in Latin America, people are looking more and more to natural cures, because traditional medicine depended on nature. Because in traditional medicine, the human being coexists side by side in harmony with nature.
Right.
And that is what people are turning towards again. Because if you look at Indian traditional medicine, it is about the well-being of the person through Ayush. It is also about the physical health of a person through yoga. And it's about the mental health of the person also through your practice of yoga.
Right.
So you are looking at an integrated approach to medicine, which was there under traditional medicine, but we lost this somehow.
Yes.
And as we advance, we realize that we have left back a very historical part of our culture and civilization that sustained society for millennials, a number of years. And therefore you have this tendency of people going back to the roots and recognizing that we have very rich systems that has relevance today and that can coexist in harmony with nature. And I must say, it was a scientific system. In that early period, there was a science behind it. So it's not that just traditional medicine has no science behind it. It has a deep knowledge base and a deep scientific base. So it's not just allopathic medicine that is science-based. Traditional medicine is also science-based.
It was just people got brainwashed that the Western
Absolutely.
medicine is comparatively
Absolutely.
better. But sir, since you just mentioned Ayush, what do you think the kind of future Ayush holds with BRICS?
I am very positive. As I've indicated, it's a mandatory working group within BRICS that functions very well. And India becomes the chair of BRICS in January 2026. And like you did during the G20, where you brought to the forefront lifestyle,
Right.
which was a very innovative way of looking at how humanity coexists with all aspects of our planet, our environment. And I'm sure we're going to see the same during India's chairship next year. And this is what BRICS has been advocating, a holistic approach to life, including recalling the rich culture and traditions that we have, all of us have, and bringing it into the mainstream. That's where it belongs. That's where it belongs.
Speaking of today's event, what was the best part? What was that you liked the most in Healthcare Summit 2025?
Well, I'm very pleased that all of the panelists that I've just listened to, including the minister, is very positive, and that we have evolved from that mindset that when we speak about Ayush or traditional medicine systems, it's an inferior system. I see so much of confidence when they speak about Ayush, when they speak about traditional medicines. It is this new confidence that we have in our own traditional systems that were there for centuries and have sustained our civilization. So that's a very positive dimension of it. And I'm glad to see also so many products on the market. So many products on the market from our Ayush medical system. And I think that's also a very positive development.
And to overcome this inferiority, when we speak about Ayurveda or Ayush, there's this program coming up where students can actually systematically read and learn Ayurveda, and then they can have doctor in front of their name.
Very much. That is something that we must promote and encourage. And I'm so pleased to see so many of our youth looking at this dimension of our medical system. That's very promising.
All right, sir. Thank you
Thank
so
you.
much.
Thank you so much
for
for
being a
having
part
me.
of this conversation and event.
My pleasure.